Good afternoon, everyone. Thanks for joining the American Ambulance Association today, along with John Eich, Director of the Wisconsin Office of Rural Health, as he illustrates how generative AI tools can help EMS providers and directors with operational tasks. This webinar is being recorded. The on-demand archive will be posted for the AAA website within 48 hours of the live session. A link to the presentation for today's session will be posted to the chat shortly. If you do have questions during the webinar, please use the Q&A chat feature. And with that, it is my pleasure to introduce John. John, you can go ahead and take it away.
Great. Thank you for that. And I appreciate the invitation to talk about this. I should probably start just explaining why someone from an Office of Rural Health would be talking to you about AI. So if you don't know, there's a state Office of Rural Health in every state. We're the Wisconsin version. And amongst our sort of national set of colleagues, I've become really interested in AI and started talking to our counterparts and others in rural health. But in a conversation with AAA, we were talking about AI, and it seemed like there was potential there. So they took a chance on me, and I hope you'll find it valuable. I just want to put one caveat out there that I aimed this. So AI is a pretty big term. There's a lot of things that are actually AI operating in the background and have been for many years. What we're talking about now is generative AI. In other words, you give it a question or a prompt, and it returns information. It's certainly what you've been hearing a lot about. And so I'm going to frame this mostly in using tools that already exist. In my research for this, there were many ideas that were created that I think would work really well for a vendor. But I wanted to, like I said, sort of aim this at service leadership and providers with tools that already exist. So that's the focus of this, and we'll get started on that. So I'd just like to point out that the image created for this first slide was done with ChatGPT. That's the one I used for a lot of this. So you can imagine yourself using these kind of tools and looking at these results for your own presentations, whether that's to a municipal board or a nonprofit board, presentations to the community, etc. One of the things I really like about the images that are created is they're copyright free. So you don't have to worry about getting dinged by some lawyer somewhere in New York for using an image that has copyright on it. So this was the first thing it created. This is the second, just so you can see, one of the lessons of using generative AI is that every prompt, every variation can be different. And so it's good to make sure to use to keep trying if you don't like what you get in the beginning. All right, so this talk, we're going to talk about using generative AI in these categories. So supporting your leadership, service operations. It's like bringing on an HR person if you don't already have one. Improving your communications, helping you with your recruitment and retention, and then finally supporting providers as well. I think there's some really interesting options for that. So let's dive right in. So again, all the images you see were generated by ChatGPT. There are better image generators out there like Midjourney, but I was already brainstorming with it. And so I thought I'd give it a try, and it actually worked really well. So let's see. So in leaderships, these are ways, things that what I'm imagining a service leader and lieutenants and others could use, ways to use this. So sometimes if you're in leadership, you find there's really not a lot of people you can talk to because you can't necessarily talk to those that you're supervising about it. You may not have somebody that you can reach out to make a quick call about something. Sometimes you don't want to share sensitive information. And oddly, using ChatGPT, almost like a colleague, And you can tell ChatGPT, I want you to act like an experienced EMS professional. I want you to, have this kind of tone. I want you to think of yourself operating in Michigan or wherever you might be operating. You can get that foundation started and then move forward and ask it questions. So you can oddly ask it questions like, I've got this situation. You can be very conversational with it. You can go back and forth. It's not so much like a Google search where you do one question and then you just hope for the best. You can ask a question. You can say, nah, that's not really what I needed. Try this way, or tell me more about that, or this is too much information in this stuff. You can be very iterative in this way, very conversational. So you could bring up, I have a struggle with someone on staff who's doing this thing, and acting as an HR professional, ChatGPT, how would you recommend I handle this, or etc. So I think that can be, you can't always reach out to someone. Maybe it's a bad time, but 24/7, this is available to you. If you want to brainstorm a topic, like, for example, coming up with a presentation like this, and I'll get into that in a bit, but you can brainstorm on pretty much any topic you'd ask a colleague. So what if we changed this kind of operations? What if we changed our schedule to be that? What if we, changed our mix between paid staff and volunteer, etc. You can sort of model those things out. Management tips. What would you recommend about, how can I be a more effective leader in these ways or those ways? Strategic planning. You can upload documents that you already have created, or even just an outline that you've created and say, all right, this is the beginning of a strategic plan for our operation. Let's, flesh this out, bring more to the table about this. So it can be a great brainstorming pal in that way. You can ask it, you can upload kind of really very complex documents, and that might be some new regulations, it might be a new policy, it could be legislation, it can be huge, could be a part of the Federal Register, all sorts of things. And I'm sure many of you, like all of us, have less time than you'd like for these sort of things, and who wants to sit down and wade through a lot of this stuff. You can upload that document and then ask questions like, all right, ChatGPT, you've read this and analyzed it. Give me a quick summary of it. Give me a summary, and then you can ask good questions like, tell me more about the part, about this part of it, or does it say anything about that? Or what about this case? What about that case? So again, that sort of experienced colleague that you can feed it information, ask questions on it, and go back and forth. It's pretty remarkable. Another way of utilizing this as a leader is, in a sense, an analyst for decision making. So you can upload not just a text document or a PDF. You can give it a spreadsheet of data. I uploaded an image and it analyzed it, the text within that. So you can feed it whatever version of data that you have, and then ask it to summarize that for you, to ask about things that stick out, anything that looks like a red flag. You can feed it data and then say, how does this and then also upload documents that you need for compliance. Like, we have to be in compliance for X, Y, and Z policies or issues, statutes. How do these policies, how are they in compliance with these other statutes, etc. So that's a very powerful as a tool. And I think that this was one of the areas where I feel like there's a lot of room for vendors to step in here, because if somebody really wants to dive in and create a whole cloth, kind of their own engine for doing data analysis, there's a lot of opportunity. AI can really help out here. I think for most leaders, they don't want to bother to create a whole second business. So again, I'm just trying to confine this to what you might find useful today. You can model scenarios for staffing, like, well, what if we did this? What if we added this, did more of that? You could start with a spreadsheet and model things out. You can have it create a spreadsheet. You might just, you can scribble down a bunch of data and then say, turn this into a spreadsheet, highlight this column, all that sort of thing. You can use it for budget planning, system upgrades, all these kind of, well, what if questions. you could have it serve as your analyst for that. You could say, all right, we're thinking about making these kind of changes to our protocols. What are the risks that we would be looking at? And then once it says, okay, here's 10 risks that could happen. All right, what are indications of those risks? Like, how would we know that it's going to happen? So again, you just keep asking questions. Oh, how would we know those risks are about to occur? Oh, well, for these 10 risks, here would be some warning signs or indications. Okay, well, if those risks did happen, how would we mitigate them? So you see what I mean? You can just keep rolling the conversation forward. Very helpful. Another aspect I think that plays into leadership, but also just operations in general, is your communications. I know that some people are very comfortable in communications. They're very comfortable in their writing and their presenting in person, speaking live. Other people, not so much. Some people didn't love their time in writing essays and getting graded, and they sort of bear a bit of they have some feelings about that. So one thing you can use is have this tool help you with your writing up a speech, you're coming up with a presentation, your language, like make it more formal, make it more diplomatic. You can rant to ChatGPT, be like, I can't believe blah 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 blah. You can use a voice dictation input method. You can just click on the little microphone and you can talk to ChatGPT like a person. It's really kind of terrifying. So you can just rant to it and be like, all these things happen. Okay, I need to email this so-and-so about it, but I need it to be more diplomatic. And so it'll give you, well, how about phrasing it this way? How about saying it that way? Okay, that's good, but don't forget this point or whatever. It can be really helpful in that regard. So part of this is, I think, is an incredible ability, and this is what I use it for a lot. And that is starting out with some rough ideas and then just talking with the robot to help expand on that, to polish it, to put it in this format or that format. So let's take this presentation, for example. When I started, and this was a little bit early, I started out with like 10 ideas, like, oh, you could probably do this, you could probably do that. No, right? So this diagram is the way I like to brainstorm. You just kind of put things out there. I'm just getting started, and I thought, wait, why don't I already feed this into ChatGPT? And after some back and forth on that, here's what it came up with. So this is how much thought the AI can put into all of these things, like HR tasks, for example. It was kind of thin on what it was suggesting there, and I said, well, say more about HR and policy development, and you can see it was very robust. This mind map was only the things that I thought were the most valuable of all of the things that it suggested. So it is an idea generation machine. So if you're ever about to talk with, again, you're making a presentation, you've got an important meeting, you're thinking about making some changes, you can just start out with some basic ideas and flesh it out into something that's pretty incredible. Would I have been able to think of all of this? Probably not. Most of it, sure. But this saved me so much time being able to just jump right into, all right, let's turn this into an outline for a presentation. All right, so other ways you can use this. You can think about your internal email. Sometimes there's a tricky thing you have to convey to the staff, to your coworkers, again, municipal leaders, boards, etc. So you can help kind of flesh that out, change the tone, create memos and reports. If you didn't take Business 101 in high school with your typing class, you don't quite remember what a memo is supposed to look like. ChatGPT to the rescue. If you want to turn that into a report, if you already have something that someone created and you want to edit it, make it better, you can, again, upload and ask it to improve things. Talking points and even scripts for presentations. Here's a fun thing. A lot of times when you're making a presentation, to folks that are worried about your funding, it's helpful to wow them with data. And so you can feed some, upload some data and then say, I want you to help me visualize this. You can either ask it, how would you suggest visualizing this? Like what kind of chart or blah, 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 and it'll tell you. Or could you do that for me? It will also do that. And that, I would say that's pretty good now, and it's getting better every month. So in your communications, you're creating materials, I'm assuming, for recruitment and your community engagement. Maybe part of that is Facebook or other social media. And so you want to kind of stay relevant. You have to keep putting information out there. Don't forget, we're still recruiting. And so maybe you want to mix it up. Maybe you want to make it funny. You want to make it creative. Just ask ChatGPT for a bunch of ideas about what social media posts around this. You can, again, upload what you've already done. Say, here's the text of the posts or an image of the posts I've already made. So we've already said that this is kind of the tone we like, and it will generate new ideas for you. It'll even write them up. If you're writing up a grant proposal, you can have it start everything from, again, the outline to flesh that out. I want you to hear, I've uploaded the guidance for the grant. So help me write and check over what I've written, other funding applications. All right, so let's talk about moving from communications into sort of HR policy and operations. And so I know that I do this. I'm assuming that maybe the rest of you might have some experience with this, where you're like, okay, yeah, that's a big project. That's a lot of work. Maybe I'm less comfortable with that. And so I'll get to that someday. I'll get to that. When this fire is put out, then we'll have this stretch of time and I'll do it. You can turn it very quickly around from here's a bunch of ideas to here's the handbook that you can give to the next new staff. So maybe your service operates more kind of in, let's just call it common sense mode. You haven't written down a bunch of stuff. You sort of develop solutions to things, not from a policy, but as they come up, just like, oh yeah, that's a problem. Let's see. I guess our policy on that is X or Y. You can actually ask it, say, again, imagine you are an HR professional in an ambulance service. What would you recommend? You're an expert HR professional, give me a set of guidelines and policies for our service. As an example, and this is kind of a weird example, I started up a makerspace, like a community workshop, and something came up for us where people wanted to start working on guns at the building them and things, repairing them. And we're like, oh, we should have a policy for that. And a friend of mine turned to ChatGPT and he said, what's a firearm policy for a makerspace? Bam, gave us like 2 or 3 pages. It was almost perfect. We changed about 3 words and we're like, there you go. There's the policy. Something that we really would have had to think through. It's tricky. You want to allow people to give people capability, but at the same time, you don't want them doing dumb things. So how do you create policies so people can't be dumb? And so again, this could be something where you could take whatever policies you already have, write down whatever ideas you want to add in, upload that and say, all right, come back with some more comprehensive policies. You could customize them. Let's say you've got your policies. You could go back to, because ChatGPT, if you don't tell it not to, it will remember what you've talked about before. And so you can say, hey, remember those policies that you made about blah, blah, blah? I'd like to make some changes to them. So tweak the overtime settings, the standby pay, etc. This way and rewrite them. And it'll just be like, brr, done. Very helpful if you're not trying to search through the policy and maybe there's 2 different sections that reference a similar thing that you'd have to make sure don't read differently. Let's see. So speaking of which, you can take your policies and upload state and federal laws, other policies and regulations and say, okay, check these policies against those things. Now, not only ChatGPT, but many of the other generative AI models can search the web, so you don't even have to upload it. You can just tell it, go look for the relevant policies, da 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 da, and it will just do that, combine it, and again, sort of have an analyst that way. That bit I was talking about before, so it can analyze it to make sure you're not repeating yourself too much, that there's not inconsistency between sections, that there's not a bias that you're not aware of, because a lot of times we're not. So very, very helpful stuff. If maybe there's just you or a couple of you in leadership and you're doing the best you can and you're also running calls, it can be very helpful to have really what is an experienced colleague to turn to for advice. And then finally, you've come up with some things that you like. You can say, format this into a PDF that I can print out and give to new employees, or put on the web, or whatever you want to do. You can tell it how you want it to look, how you want it formatted, etc. So you can use it to help build schedules. So I know that scheduling can be a nightmare in a lot of ways, like, oh, so-and-so wants this day off, but not that day, and this other thing. But we want to make sure to match skill levels, so we've got kind of a blend. And so this is a tool I think you could do with existing tools, and you for sure could build something with existing tools, and we'll get into that later, to analyze this. But the opportunities here are pretty incredible. You could have it generate onboarding checklists. So again, take your policies and say, this is for new staff or new volunteers. What would be an onboarding session? Give me an agenda for an onboarding session. What should we talk about? How long will it take? Talk more about this or talk less about that. Give me a checklist to make sure we've addressed all of the things. So once they're already on board, you've got your staff. Performance reviews can, I think, too often be another sort of intuitive thing, like, yeah, you're doing great, or not loving this last quarter, buddy. Which obviously you want to be human about it, but it can also help to make sure that you've got a plan for an evaluation, that you're looking at kind of consistent metrics, and you can brainstorm that with your robot pal. You can have it generate, write up review templates for you, create evaluation questions, all that. Let's say you've got a situation that you're pretty close to, maybe you've got some emotions about it. And so again, you can turn to your robot friend and say, all right, like, here's the situation, here's what I feel about it, but I need to be more neutral and professional about this. Or what would be a way to seek conflict resolution? Like, so-and-so and so-and-so super mad at each other. It feels like we're never going to see some clarity on this. What would you suggest for conflict resolution? How could we handle these kind of grievances? Get suggestions. You can use it to track volunteer hours and make sure that when people are, so again, you're uploading data for this kind of thing, that you're getting consistent recognition programs. You can build a staff spreadsheet. Make sure that all of your staff are getting the QI training that they need. They're keeping track of dates for CEUs, and then let's say you've got in-house education that happens. I mean, that would be awesome. And your medical director has some ideas, and you could turn it into and just literally use it to be like, all right, we want to study these materials, create a review guide, create a study guide. You always, always, always want to check over what AI comes up with. Never copy and paste without looking at it, because it makes mistakes sometimes. Maybe it doesn't phrase things the way you'd want to, all sorts of reasons, but always check it and review it, what it comes up with. So especially if you're doing anything clinical, make sure that you are sending that to the medical director and be like, hey, remember you wanted to talk about such and such this week, this month, whatever, this quarter. I came up with a draft because everybody, or many people, I think, work better off of editing a draft than they do a blank piece of paper. So, hey, I drafted something up. See what you think of it. How would you change it? Send it to them in a Word doc. Um, and then once that's agreed upon, we'll talk a little bit later about creating study guides for staff. You can, again, use that sort of spreadsheet idea, monitor ambulance and equipment health. You can ask it to predict when maintenance is needed, all kinds of interesting things. All right, so a lot of HR operations stuff. By the way, if you have questions, I don't think I can see the chat, but feel free to put them in the Q&A and Kayla will interrupt me and we'll get them that way. And it also at the end, I'll leave a lot of room for that. So recruitment and retention. By the way, this I just want to point, I love this dude in his hat. I tried to make some changes to it and completely failed. Like the 10 generations of this image or changes to it were not good. So I went with this. So AI in a lot of ways is pretty good. It's great as a first draft. Just think of it as a first draft machine. And then you spin it, you improve it, you make it better. And sometimes you have to settle for images. You're like, okay, sure, that'll work. All right, so improving your outreach, recruitment. So you can brainstorm with it to create a strategic plan for your outreach. You can say, we're a service that is in Mississippi and we are this size, we're in Jackson, and we this is our coverage area, and this is our volunteer staff mix, or this all that. You can say, here's the parameters, and then based on that, here's what we want to achieve, and just rough ideas. Here's what we want to achieve. Now create a strategic plan for us to achieve those goals, or suggest other goals that we're not thinking of. Okay, so speaking of which, you can help professionalize your outreach plans, because everybody's going to do it based on intuition and common sense. Like, oh, we'll put a notice here, we'll tell people there, we'll buy some Facebook ads, whatever. But wouldn't it be cool if you could turn to a communications professional robot and be like, what else could we do? And so that can be very helpful. Once you've got your plan, you can say, all right, well, I need 10 social media posts. What would you suggest? What's the difference between a Facebook post and a LinkedIn post? Who would go there? All that kind of stuff. It's available there. You get marketing tips from it. Once you've in a sense, let's say you're ready to hire, you can create the job description from it. You can feed it job descriptions you currently have and say, would you make any improvements, any changes? Or I'd like it to be more like this. Please make those changes to that document. Based on this job description, come up with interview questions. What would I ask this person to make sure I'm addressing the things that I said I wanted in the job description? How would I evaluate their responses? Chat GPT, you know what I mean? Because you're just like, pretty good, sure. Well, on a scale of 1 to 5 or 1 to 10, what does that look like? What's a 3? What's a 7? You can ask Chat GPT. So again, it's like stepping up our game a little bit, or a lot of it. And then thinking about the retention side of it, starting out with, this is who we are, what we do, here's our details. What retention strategies would help us keep volunteers longer, or make sure that our staff, that reduce our turnover? Like, what is it about, what can get people to stay longer? You can say, well, I suppose I could ask them, I could ask their advice, and I'm sure we'll get a lot of answers, but in that, you'll probably also get some things you might not have thought of. So what's a good survey? And so it'll create a survey for you. You can say, well, make it less this, make it more of that. Again, it's not just one answer to one question. It's a final answer to after several questions and back and forth conversation. Another thing that I think is not, and I'm sure I'm preaching to the choir here, you all know this, but I think we don't spend enough time thinking about stress reduction, PTSD, mental health and well-being programs. And maybe that's not your area of expertise. For most of us, it's not. So you could say, hey, help me develop some programs related to these issues. Like, what would that look like? Give me a half day, give me an hour. What's a weekly email I could send out, or whatever, like what's a talk I could give? I don't know. But you can brainstorm with it and say, based on what you know from the World Wide Web on these sort of issues, what would you recommend? And if you don't like the recommendations, you don't have to take them, but at least you've started that process out. Okay, moving from the sort of operational and management stuff to what can staff and volunteers get help with? These were, I think, education support is one of the ones that seemed really powerful. Again, I've certainly talked to a lot of EMS professionals whose school was not their favorite part of their life. And so the whole idea of like, oh yeah, I could go back to paramedic school, or I could, bump up to the next level, or I've got these CEUs coming up, is not something that they're gleefully running towards with open arms. And so part of that comes from the learning styles. A lot of that stuff is like, I'm just going to talk at you like I'm doing right now. I'm just going to talk at you for several hours, or I'm going to, hand you a thick book and you're expected to just be tested on that. Maybe that's not your learning style. Maybe that's not what you're comfortable with. Maybe that's just not how your brain works. It's not necessarily how my brain works. And so you can use not just ChatGPT, but Google has something called Notebooks LM, which is super powerful and cool. And right now it's free. So you can say, create an adaptive learning space. So in other words, in the same way that NREMT works, you could say, I want you to ask me questions, upload materials, ask me questions on that. And I want you to be adaptive about it. I want you to generate a study guide. So again, you upload the text that you're supposed to be studying, or you upload the recording of a class you sat through, and you just recorded it on your phone or something and turn it into a file, you upload that. Give me study guides on this. Give me a bunch of flashcards on these protocols, or medications or anatomy stuff. Again, this is where just search for Google Notebook LM. It'll come right up. The other thing it does is, this is so cool and so scary at the same time. It will turn your text into a podcast between two speakers. That sounds so real, it's spooky. So you take your text of your study materials, you upload it, you're like, create a podcast from this, and it will talk through it. Not only does it do that, you can call in to the podcast and be like, oh, I have a question about la-di-la, and the robot hosts will answer your questions as if you're a caller. So cool, because again, maybe the way you learn best is through hearing versus seeing, reading, etc. And if that's your jam, then do this whole podcast thing, like turn it into a learning style that works best for you. Maybe it's flashcards because you need to be on a walk when you're going through them. Maybe it's a study where you need someone to prompt you with questions. It will do all of those things and help you study, and also help your staff study if you're doing something like QI training. You could ask it to create simulations. I mean, not really visual simulations, but give me an example. Give me a bunch of scenarios of using this material, and then ask me questions about them, and then tell me whether I was right or wrong, and why I was right or why I was wrong. Just to practice that kind of decision making and critical thinking that certainly a lot of these tests are moving towards. Another thing
Hey, John, this is Kayla. We had a question come in from John Blake. He said, how can AI be made HIPAA compliant? And how can AI be used for work, safety work, product activities, activities that by law live behind a legal discovery barrier?
Oh, that's a really interesting question. The HIPAA thing, yeah. I mean, I don't think so. I think you would need to purchase a subscription to a product that is trying to offer some of these services that says it is HIPAA compliant. Like, I don't think there's a way really without. I mean, HIPAA compliance is such a thorny thing. So I don't think we can do that. This is more operational and abstract stuff. When you get into patient information, I think at this point, January 2025, you're pretty much going to need to go to some product that says we are HIPAA compliant and here's our certification, right? So I think that's just the only way we can deal with patient data. And then as far as like legal compliance, that's really interesting. I hadn't considered that. But boy, I don't know. I mean, I think that's a great question. Lawyers are tricky because lawyers are always like, let me imagine every possible thing that can go wrong and then tell you you can't do any of those. And that's not really what you need. What you need is a creative thinker. Like, okay, given those obstacles, how can we work around them? So if you know a lawyer like that, that's a good question for that kind of lawyer. Discovery. Yeah, I think, and if the lawyer is good enough, they're going to be able to subpoena things that when you try to get fancy, like, oh, I'll do it and then with another email address. So let me look into that and try and send out that answer. I think that's a great question. Hopefully there's still a lot you can do that you wouldn't worry about that wouldn't get into that. And I think another thing that could be valuable is actually sitting down, if you do have legal counsel, sit down and be like, all right, when I ask these questions, what's my defense in court if somebody's like, hey, the way you handled that was terrible? You know what I mean? Like, because there's nothing wrong with asking for advice and taking what you did, but you want to think about it in advance with a lawyer and come up with a strategy. Because I don't think that should still be a non-starter flaw, but I think it's something that's worth considering. So sorry for that non-answer, but I'll try and look into it and let you know. So post-incident debriefing. So this is I would say a somewhat controversial aspect to it is, AI as therapist. But at the same time, we all talk to people in our lives all the time that are not very good as therapists, right? And so you just kind of take what you can get. And initial experiences, you can't really say studies because they're not studies yet, but initial experiences with utilizing AI chat as in a therapeutic manner have been promising. They have been positive. People find them to be valuable. And I know that, maybe in your service, there's nobody on the service with any kind of therapeutic training. So you're all just fumbling along trying to do your best. Maybe you've got leadership that really doesn't want to talk about it, isn't comfortable with those sort of things, and so they don't offer those opportunities. And so as a person who has been on the call or experienced that personal trauma during the trauma, just being able to talk about it, like, this is what happened, this is what I think. And you can tell ChatGPT, I want you to function as a counselor, as a therapist. Please take whatever they say with a grain of salt. Don't do anything that feels wrong or bad to you. But I think just being able to have a conversation, you can use the video. You can use the audio mode where it sounds like a person. And so I know we're not quite there yet, but I think there's real promise. There's real options here. And then maybe do this in conjunction. Maybe staff or service leadership can initiate a process and say, hey, why don't you also, have a conversation with this? I know it feels weird, but why not try it? and then follow up with them afterwards and like, how did that go? What'd you come up with? Think about it in terms of like a lot of times, or sometimes maybe, we have a situation, we have a conversation about it, and then we've kind of like resolved it. Well, as you know, it doesn't really resolve it. It takes time, and probably repeated kind of touchings of that topic. So that can be something that could be useful for someone, a volunteer or a staff member who's been through something like this, to just kind of like have a weekly chat, monthly chat. I don't know, whenever they feel like it, chat. This is what I've come to on this, whatever. I think there's opportunities and options here that are good. And let's see, yeah. Protect your peace. Ask it for tips on, okay, so this is what happened to me. It was pretty raw. It was completely unexpected, caught me on a left field, which always makes it worse. What can I do in a similar situation in the future to kind of safeguard and be a little bit, make it through the next event better, and see what you think of those results. I will send out, I'll share my email, just been asked for that. So let me just write it right now. It's just my last name, Eich, at wisc.edu. And I put that in the chat so Kayla can send it out to you all. Also, these slides are in a PDF, so I should have told you in the beginning, you don't have to take notes on anything that you see, because you'll be getting a copy of it. All right, so let's see. Getting started. Getting started. So what we've talked about so far are a lot of sort of abstract concepts. Oh, you could do this, you could do that. And one of your questions, if you haven't used these already, might be, great, now okay, where do I go? How do I sign up? La-di-la-di-la. ChatGPT does have a free option, but it works best if you pay it, but that's $20 a month. It's a lot more robust. But $20 a month, if you think about being able to get an experienced colleague and an HR specialist and someone to brainstorm with and someone to rewrite all of your communications and blah, 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 blah. You know what I mean? Like that's a pretty good deal so far, who knows? Next month they might raise the prices, but there are other tools that use it. That either use it like Bing, Microsoft has a deal with them where you can use it through them. There are other services that are popping up like every day, there's new services. There are other options to ChatGPT. There's something called Claude. There's something, Google has Gemini. There's a bunch of smaller tools out there that you might like better or might be cheaper that you could use. So getting started, I wanted to just do these 3 links that were helpful to me. The first one is just literally, all right, where do I go and how do I sign up and what are some things to think about? And then a newer version by that same content creator, 30 ChatGPT tips. Those are very new. Those just came out in the last month. And then for those of you that are interested in taking it even a step further beyond just ChatGPT and having conversations with AI, this 8 tools I wish I'd used sooner might lead you in a direction. And one of them is this basically kind of portal where you have the option to try out, so you don't have to buy the whole subscription to every service you might think might be valuable. You can subscribe to this portal and then you just get charged, say by the minute or whatever, for whatever thing you want to try out. So you can play around a little bit. It can be fun. Also, a tip I learned, if you decide to try this for work, don't be afraid to ask it a bunch of questions on your time off for like, I want to build a porch and how many, of these parameters and this height and how many 2x4s would that need? How should I cut my plywood? You know what I mean? Like you can ask it whatever you want. Like what's a sympathy card? Like I need some text for a sympathy card for my aunt, blah, 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 blah. And because every time you use it, not for work, you're learning how to interact with it. You're learning how to think as it thinks. So all of that is useful practice. So ask it every question you can think of. Let's see. So there's the links. I also put those QR codes, so hopefully you can just use your phone for that. And I believe that is all I have. So hopefully you found that valuable. And so can I now stop sharing and we have a conversation?
Yeah, Jen, you can go ahead and stop if you'd like. So we'll just, I guess, reach out just to see if anyone does have any further questions for John. And if not, like he did share his email earlier, but Eich, EICH at wisc.edu. So if you wanted to reach out to him directly, you certainly can do that with any questions or to the AAA. Let's see here. And it looks like we do have a question from Nathaniel Reel. He said there are some companies that sell a compliant chatbot such as Bastin GPT and Compliant GPT, which will also provide a business associate agreement, BAA, with HIPAA regulated entities.
Cool. So I would be, yeah, that's great. Great information. Thanks, Nathan. And I would be shocked if there are not businesses already working on this issue. And so I think it's something to bring up also with your like maybe your state association, with maybe you have kind of a regional group or association. How do we want to use this together? How do we want to go in together on something? So as far as like, is anyone, basically you find your people who have passion around this, like, hey, I don't have time to do this thing, but I think it could be really useful for those of us, in this group or in this region or in this state, who wants to create something, because right now it's the ground floor and could be very interesting and very powerful what gets created out of it. But yes, as Nathan has said, there are already options on the table for that.
Thank you. And then a question from Diana. Is there an AI for EMS group or similar that meets routinely? It would be helpful for agencies to potentially converse with each other, share ideas, etc. Many agencies likely have similar use cases, maybe can share prompts, etc., or concerns that have come up at their agency.
Yeah, that sounds like a perfect thing that AAA could host. Not to speak for you guys, but I think that's something where within the membership, somebody could say, "Oh, I'll host the call, whatever, every month or whatever period of time, or let's just all email each other. You can give, So I hate to speak for you, Caleb, but that seems like a real opportunity for membership value.
Yeah, I can certainly pass that on to the team. I believe that would be valuable as well. So thank you so much. And then we had a question from Ashley. Is there a way for EMS providers to use AI to chart for them while they are on a scene of a call? Example, EMS provider turns AI on while they go to a call. By the time the call is done, their chart is done as well by AI.
Yeah, I definitely feel like that's where we're headed, because every vendor who's in this space has got to be thinking of something like that. It's going to be tricky with HIPAA. And so I think, on one hand, you could always dictate to whatever tool you have and then turn that into something. But again, with HIPAA, that sounds risky. And so I think the best way is to either find some of these HIPAA compliant services or to pressure your vendors to create something, a feature on their tool, and they're already thinking of it. I know they are. But that is totally, I think that is so important in this era and world we're in, where everybody wants all the information in all the little fields and forms and boxes and multiple screens. The way to make sense of that is to have a tool do that for us, where you just say what you're thinking and it prompts you with questions, and then it fills out the form appropriately. That's definitely where we're going. I wouldn't try and use one of the ordinary tools for that. because of HIPAA, I try and pressure your vendors to create those features.
Okay. Thanks so much. It looks like, let's see.
I see Boris commented,
Yeah.
currently CMS hasn't issued regulatory guidance. That's true. So right now it's a bit of the Wild West. I'm sure at some point they'll maybe, it's hard to say with the Trump administration what their priorities are yet in this regard. And so, you know, maybe they'll be hands off. It's hard to say. And I totally agree with Nathan that yeah, you won't lose your job to AI, but somebody willing to use it. AI is not the thing, you know, the media likes to talk about AI as, oh, the robots are going to take over. At this stage, it's not that yet. It's other people who are doing what we do, who are comfortable in this and can be enormously productive because of this. And so I think this could be, obviously, I'm really partial to small services, rural volunteer run services. And I think that they need every trick in the book to provide services. You know, they're being asked to do so much with so little. And I think if we can figure out ways to get help, to get assistance, right? And tools that we can leverage, all the better. And so again, this is something I would bring this to your state association and be like, what are you guys doing? Like, create value for us. Like, go out there, figure this out, and get me something, you know, prompt me, give me a bunch of prompts, give me a bunch of ideas, give me a tool that you've already built yourself. Because if you don't have time, somebody should create that so that you can use that tool. Because this can be incredibly powerful. Karen, I know of a software company created a feature allows a medic to speak. Oh, good. Yeah. So already they're working on, like I said, they are for sure working on this. AI on billing. Um, I think I got a LinkedIn request from someone who has a company that is cloud-based, out of South Carolina, that is specifically around billing functions. And so I think this is a question. There's two questions for this as you're considering vendors and services. One, how are you using AI? And two, they can't just give you a bunch of business gibberish, like, oh, we're totally leveraging our whatever. It's like, show me the features, give me a demo, show me how this is working right now. Not a lot of promises for the future, because people can sprinkle AI dust on everything and look fancy. But some places are going to be able to leverage this in a powerful, sane way. So that was kind of
Okay.
a non-answer. I hope that was helpful.
All right. Well, thanks so much, John. Any more questions at this time for John? I did post his email in the chat as well. If anyone wanted to follow up with him outside of the webinar.
Yeah, I've enjoyed talking to you all. I wish I could see you. I love presentations more in person, but I'm glad that we could at least sort of have this dialogue today, and I appreciate the invitation.
We did actually have one more pop in from
Oh,
Karen.
good.
I know some states disallow or heavily restrict AI and EMS. Where is Wisconsin in that mix?
As far as I know, I haven't heard of those kind of restrictions. That is certainly, that is an approach to AI, which I think is wrong-headed, is just like, be like, no, you can't use, like, can't use it. It's like, say, it's like I used to be in carpentry, a carpenter. It's like saying you can't use a nail gun because it's dangerous. Like, yeah, it is really dangerous. Don't aim it at your foot. But at the same time, who would build a house without a nail gun now? AI is that same kind of tool. There are risks and there are dangers, and it can hallucinate and give you wrong information, yada, yada, yada. But oh my God, all of the things it can do. And I'm here to tell you the things that it will do. Like this is our future. We're not going to stop this. There's way too much money to be made in this. And so our job is to get comfortable with it, even if we don't use it. Like, even if you walk away from this webinar being like, that's fine, but at least open up an account, give it a try, ask it some silly personal questions and just start to be like, oh, okay, I get it, I get it. Because a year from now and 2 years from now, it's going to come up again and again and again. And you want to be in a position for career advancement, for just maintaining your job, etc., where you're comfortable in this kind of thing. So play around with it, give it a shot.
All right. Well, thanks so much. Again, everyone, thank you all for joining. Just a reminder that this webinar will be posted on the American Ambulance Association website within 48 hours. And thanks so much again, John. It was a pleasure having you today, and we hope everyone has a great day.
Take care, everyone.
Thank you.